For many years, the humanitarian mental health and psychosocial support community has focused mainly on response. We try through this workshop to focus not only on the response or on building back better, but actually in getting ready before emergency happen.
For the first time, we had multiple sectors of humanitarian and preparedness response, MHPSS actors, disaster risk reduction actors, people from protection, education, coming from all over the world to actually learn about MHPSS as part of emergency preparedness and risk reduction.
So during the course we did different simulation exercises, and this was a way for the participants to engage in real-life scenarios and to prepare for future emergencies.
We used together innovative methods, from problem solving based on scenarios developed from previous emergencies, included within 2 days of theoretical trainings, followed by a 2-day simulation exercise where we worked together on a simulated scenario. The participants worked together through a simulated scenario where they have worked as part of 3 international organizations, one focus on health, one focus on protection, and one focus on education, and they responded together to the emergency as the scenario has evolved.
The main idea is to learn how Ukraine can enhance its preparation to possible escalation of the war or other disasters or emergencies happening. And I think it would be really useful because in Ukraine we already had a war that started in 2014. So there was some preparation, even though we didn't know it was preparation for the outbreak of the big war in 2022. So we are hoping to enhance our knowledge in preparation to emergencies.
Lebanon have been through a lot for the past 10 years. It started with Syria crisis. It was followed by the Beirut port explosion, and then we had the COVID-19, and then the financial crisis and the political crisis, and now the cholera outbreak. So, and in our nature as human, we like to prioritize, and in operation and in emergency, we'd like to attack and support, and we forget sometimes to take into consideration as shelter and wash and relief intervention. We forgot the mental health and the PSS component.
We've experienced a few challenges, particularly because Cabo Delgado, which is the northern region of the country, has been experiencing conflicts for a few years now. And this compounded with the disasters. We've had cyclones in the last few years, and this has really made the community quite vulnerable.
There are a lot of notions that when we did the simulation and the working in groups, we were able to really see what kind of impact they could have if we really design a program to implement them. So,
as a psychiatrist, I think it's very important to learn about how to detect people in the society and to come to them. Not just wait them after the problems occurs. That's the main important thing that I learned in these 2 days, I think.
The things that we've done today are diverse. We've gone through a lot of information, part of that being going through how to look at risks and map out the risks for mental health programming, as well in specific scenarios. We used different case studies to go through that information. We talked about monitoring and evaluation, as well as a number of different topics about the overall framework that mental health is addressed through.
We raised awareness on stress and the importance of mental health and also common signs in stress.
The whole workshop so far is going very participatory, is a lot of interactive, and some of the tools which has been used, applied is quite interesting. As you say, it's a quiz. It's very nice to be there.
Well, we know that children and adolescents are among the vulnerable groups when an emergency hits a country, and it is very important that we always take into account their well-being when we are planning, preparing, and recovering from and responding to our emergency, as well as in the recovery phase. So many of these tools that we have used here and have been shared with us will be also disseminated and used to build the capacity of UNICEF's country offices to prepare better for emergencies, and always try to integrate mental health and psychosocial support in emergency response plans, as well as build the capacity of governments in order to be able to recover and bounce back better after an emergency.